Welcome to my channel, Brainies. In today's video, I'm going to deliver the content about the topic, the Bell's palsy. It's a condition which causes sudden weakness in the muscles on one side of the face. The weakness is short-term and improves over weeks. It is due to the inflammation of the seventh cranial nerve, which is the facial nerve, and it is an acute unilateral low motor neuron facial nerve paralysis. It presents suddenly and peaks within the 48 hours. The weakness makes half of the face to appear to be drooping, smiles are one-sided, and the eyes on the affected side is very hard to close. So the following are the etiologies. The first one is a viral infection. The viral infection causes the facial nerve to become inflamed and swollen. The virus inflammations are the following, that is the herpes simplex virus HSV1. This virus that causes the cold sores, which is the most frequently cited cause. The other viruses are the chickenpox virus, that is a varicella zoster virus, which has been shortly abbreviated as VZV, the Epstein-Barr virus EBV, and the influenza have also been linked to the Bell's palsy. And the other one of the important cause is the nerve compression. The inflammation causes the nerve to swell, and the bone passage, that is the way it travels through, is too narrow to accommodate the swelling. This compression interrupts the nerve signals that results in the facial nerve paralysis. The risk factors are the pregnancy, that is Bell's palsy is very common in pregnant women. High BP, hypertension is one of the risk factor, obesity is a risk factor, and the upper respiratory tract infections are very common to cause Bell's palsy. Diabetes is one of the risk factors in Bell's palsy. The clinical features of the Bell's palsy are the facial weakness. There could be sudden paralysis or weakness of all the muscles on one side of the face, affecting both the upper and the lower parts. Facial drooping, a drooping of the eyelid and the corner of the mouth on the affected side. Eye problems, there will be difficulty in closing the eyelid, which can lead to a dark eye or excessive tearing. There can be drooling of saliva, and this is the picture depicting the clinical features. So the other clinical features are the pain, the difficulties in speech and eating. It's a rapid onset process, and the sensory changes like numbness or the tingling of the cheek and mouth. Patient may be sensitive to loud noises, which is hyperacusis. And there's a diagnosis for this Bell's palsy, which is called as Bell's phenomenon. An attempt, that is when you ask the patient to close the eyes, an attempt to make the eyes to close can cause the eyeball to deviate laterally upwards, which is called as Bell's phenomenon, which may be positive in case of Bell's palsy. The medical managements, it includes the corticosteroids, that is prednisolone within the 72 hours, antivirals like acyclovir or valacyclovir, and eye care like eyes can be lubricated, eye patch can be kept at the night to prevent the infection. Pain management, analgesics can be taken, of course with a prescription. Monitor for further complications like corneal injury. The physiotherapy management, the goals of the physiotherapy management are to maintain the muscle tone and prevent contractures, promote symmetrical facial movement and improve the neuromuscular control, and to protect the eye and the facial structures. So the techniques are facial massage can be done, thermotherapy can be given, neuromuscular re-education like mirror therapy to regain the symmetrical control can be done, and facial taping for synkinesis reduction when it is indicated. The other exercises, that is other physiotherapy management includes the active exercises, which can be asked, patient can be asked to perform the exercises in front of the mirror. Raising of eyebrows, frowning, gentle eye closure, blinking practice, smiling, lip puckering, cheek inflation, controlled release. Pronunciation drills, like they can be asked to pronounce O, E, P, B. The frequency of the exercises can be from 3 to 5 sessions per day, and it can be controlled, short and controlled repetitions can be done. So the precautions of the physiotherapy management, Ask the patient to avoid overexertion, which may worsen the synkinesis. Emphasize the quality over the quantity of the movement. Stop exercises if the pain or increased tightness develops immediately. At once it has to be stopped. Encourage adherence to the eye protection on a routine basis. Thank you. That's it with today's video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.